Did you know a messed up spine causes more physical suffering than diabetes, heart failure, lung disease, or even rheumatoid arthritis? It affects almost 7 in 10 adults, yet most people haven't ever heard of it. So that's what we're diving into on this episode of Back Talk. Welcome to Back Talk with Dr. Ryan. I'm Dr. Ryan Wohlfert, and on each of these episodes, I address the most common questions and misconceptions about back pain and spinal health in general, how you can address and strengthen your spine and be your own guarantee for your health in your life. So today, we're going to be talking about and diving into adult spinal deformity. So check this out. Here are the ASD facts. Obviously, that's short for adult spinal deformity. It affects up to 68% of the elderly population, has a negative impact on the health-related quality of life. So HRQL, it's a functional assessment measure of these elderly patients. And this is one of the findings from this study, is it's the global burden of ASD was huge compared with other self-reported chronic conditions in the general population of 8 industrialized countries. So this was a huge study. So first you have to understand what the heck is adult spinal deformity. Well, there's 4 measures, okay? So I guess 5 if you count, like you have to be 18 years or older. So you're over 18 years old and you have any one of the following criteria. And don't worry, we'll go over what these mean and what it looks like to qualify as ASD, to qualify if you have adult spinal deformity. So a scoliosis over 20 degrees, sagittal vertical axis greater than 5 centimeters. Again, that's 50 millimeters. That's about 2 inches. Again, I will explain these. We'll go over these. Pelvic tilt angle greater than 25 degrees, which essentially that means your low back is flat. It's lost most of or a lot of the curve or the curve that it needs to help sustain and make sure that there's stress off of the spine. And then a thoracic kyphosis over 60 degrees. So that's what's commonly referred to as a hunchback, that hunchback posture. Again, let's go over these. So first, there's the scoliosis of over 20 degrees. So a scoliosis is a side curve. So as this is measured from the Cobb angle, so the topmost vertebrae that's tipped one way and then the bottommost tipped the other way. And we measure that angle, and anything over 10 degrees is qualified as a scoliosis. With adult spinal deformity, it's got to be over 20 degrees. And you see this one here is measured at 58 degrees. And I wanted to show you one that's about 20 degrees. And again, you'll see that I flipped it to make sure that we're looking at apples to apples. So we're looking at it from the back. So again, this is the left side of the spine, right side of the spine. And this is about 20 degrees, so a 19-degree scoliosis. And you might think and have the mistaken thinking, okay, it's not that bad. Well, the problem with even one of these that aren't that bad is they can progress pretty quickly because it's a weakened structure. So let's take an example of hammering a nail, okay? So let's say you are, most of you has probably like hammered in a nail before with a hammer. So if the nail is straight up and down, there's no bends in it, and you hammer it straight, it's going to go in the board. It's going to go in, the wood pretty easily, pretty strong. It's lined up. But let's say there's a little bend in it, maybe you hit it and it got bent just a little bit. Now, if you take a hard hit, that's going to bend it pretty quick. But usually with life, and again, I'm equating this with a scoliosis of 20 degrees or less, or maybe 15 degrees, which I guess is less than the 20, obviously. If it's got just a little bend in it, and then you just tap it, again, going back to the nail, just even a little bit with a lower level of force, guess what? That nail is still going to bend. It might take a little bit more time, but because it's weak, it's going to keep getting weaker and weaker and weaker in bending. Okay, it's going to keep, and it's the same thing with the spine. Typically, we're not like having huge impacts, physically, like falls and accidents and crashes every day, but we do have gravity on us. We do have these other physical stresses of walking and moving and bending and lifting smaller things over and over again. And those is like, again, hammering that crooked nail. So here's one that, again, I'm assuming you're not familiar with the name of it, but I'm assuming you are familiar with how it looks. Just like that first image that I showed you here with this gentleman bent over. Again, that's showing this here. So it's sagittal vertical axis. What that means is you want the base of your spine, your pelvis, okay, S1 lined up with C7, which is the bottom, the bottommost neck vertebrae, C7. There's 7 cervical, 7 neck vertebrae, and we want that lined up with gravity. We want C7 over S1. So that's what you see here in this first one is a sagittal vertical axis of 0. So it's lined up. So C7 is lined up over your sacrum. That's what S1, your sacrum. Now here's a 70 millimeter. So again, that's over the 50. So 70 millimeter shift forward where that's not lined up. So this is, again, a criteria for adult spinal deformity. Remember, you don't have to have all 4 of these. You just have to have one to qualify as that. Now, what if you have multiple? Well, then you're like you're accumulating the stress on the body, on the spine, on the nervous system, and it's causing it to break down even faster. So that's 70 millimeters, and now this is 95 millimeters. And these aren't, all too uncommon. Look around as you're walking around your day, as you're seeing people on maybe even TV or you're in the store, you're in church, you're seeing people hunched over and they're not moving too quickly. And those are related. So that's sagittal vertical axis. So sagittal meaning from the side, vertical meaning up and down, and then that's the axis. It's got to be less than 50 millimeters to not be ASD. But if it's over 50 millimeters, which again is about an inch. Okay, so now next. So this is I just put flat low back here, it's called pelvic tilt angle or your sacral base angle. Don't get too caught up in those terms. I just wanted to show you what a flat back means. So flat back, this curve here, and then this angle here is less than 30 degrees. Now, ideally, you want this lordosis, it's called, in the low back, and you want, from research showing it's 40 degrees. 40 degrees is the ideal curve for most people to not have back pain, but then also the flatter it gets leads to adult spinal deformity and more chronic back pain over time, as well as other health issues, which again, we'll summarize at the end. So that's called flat back syndrome, but just really focus on what the low back is. So let me go back to this one here. This is an exercise that a lot of people are told to do. Patients have come in and said, I saw this exercise, or my doctor or whoever, my therapist said, do posterior pelvic tilts where you're tucking your pelvis in. Well, if it's already flat and we're straight flattening out even more, that's not going to be great for your spine. And again, lead to flat back, flat low back, adult spinal deformity, which has a big negative impact on your health. And then the last one here of the criteria for adult spinal deformity is called thoracic kyphosis or hyperkyphosis. Your thoracic spine should have a kyphosis. We just don't want a hyperkyphosis of greater. If it's over 60 degrees, that means adult spinal deformity. 40, like 37 to 40 degrees is the ideal curve. And, it's interesting. Your body's pretty darn smart where it wants to be in a balanced state. For health, it's in a balanced state. So we want a curve in your neck, a curve in your mid back, go in the opposite direction, and then a curve in your low back. So again, a lordosis, kyphosis, lordosis, 3 balanced curves to help protect you against the stress that you're placing on it. So with a kyphosis, it's similar. I mean, we'll take that same analogy we did with the scoliosis, where if it's in this bent position, well, now it's weaker. It's not able to withstand the even gravity. Over time, it keeps getting weaker and weaker and weaker. So this is that hunchback appearance that you have. And if it's over 60 degrees, then that means, again, adult spinal deformity, which is a big health issue that nobody's talking about. That's why I am, and you need to know about it. And here's the study. And this is what their conclusion was. So ASD has a greater negative impact on physical health than rheumatoid arthritis, diabetes, congestive heart failure, or chronic lung disease. It's in the European Spine Journal back in 2015. And this is big because you hear a lot, I know you do, you hear a lot about heart disease, about lung issues, about diabetes, metabolic issues, but how arthritis, but how often are you hearing about, well, maybe the spine is correlated with that. Maybe the spine is the reason, or even worse than having one of these. And maybe if you address your spinal health, address your spinal structure, maybe your heart will actually start functioning better. Maybe your lungs will function better. Maybe your organs will function better. Well, guess what? They can if we take the pressure off of the spine, because it's taking the pressure and stress off of the nervous system. Now, this isn't a death sentence. This isn't you can't do anything about it, because there are non-surgical ways to address this. And it's just like, for example, these are home units. You can't use these without the instruction and direction from someone who knows how to train you with this, because we need to make sure they're put in the correct position on your spine. Well, even first is find out what your spine looks like, so then we can identify what type of exercises, what type of traction are going to be the best to retrain your spine and your body away from these adult spinal deformities, whether it's a scoliosis, whether it's that hunched forward thoracic kyphosis, whether it's a flat low back, whether it's the sagittal vertical axis, where again you're flexed forward and you're causing so much stress on your spine and on the nervous system that it's not able to function. So we have to retrain it, just like it got that way, usually, typically, gradually, with stress over time. We have to work it back into the right position. Very similar to how you put braces on teeth to work them back into the stronger, healthier, straighter position. The spine works much the same way, and we use these traction devices to do that. So that's one thing. Another thing to do and keep in mind is this is one, how can you start to do this at home? How can you start to incorporate nutrition and exercises, adjusting your lifestyle throughout the day so you're not putting undue, excessive, even low-level type stress on your spine and causing it to break down into these adult spinal deformities. Type spine in the comments. I'll send you my spinal hygiene mini class to give you an overview of what you can start doing. And then lastly, the thing I would recommend the most is, one, to meet with me. Let's do a posture and spinal mobility assessment to see where you're at, because we can look at your posture, we can look at your mobility as a window to what your spine looks like and your nervous system, how it's functioning. So then I can help direct you to what the next steps are, whether it's different exercises, whether it's types of traction, or whether, maybe, and this is very common too, you need to get standing spinal x-rays, and I can help you find someone and somewhere to get that done. And we can analyze those to make sure that we're putting your body, your spine, your health in the absolute best spot. So you're not suffering with these physical effects, suffering with these physical ailments that is limiting what you can do. Okay. So there you go. That's adult spinal deformity. Appreciate you watching. Definitely comment below with spine if you want that spinal hygiene mini class. If you have any questions, comments, leave them below. I'll put a link in the description for the posture and spinal mobility assessment so you can schedule that, book that, and then guess what? You'll be on your way to being your own guarantee for your health and your life. All right. Thanks so much.